Doctor, why do you post root canals that you do on anterior teeth and premolars? They're so easy. You don't need to post those root canals. Remember, I made a video about why I really dislike cold test, because cold test sometimes can give us a false positive or false negative results. And this is exactly why this referring doctor very likely doesn't follow me and hasn't seen my video on why I really don't like the cold test. I do cold test. I'm not saying that I don't do cold test, but when I cold test, in order for me to accept the results, there are certain criteria that need to be met. For example, here I have a report from the dentist saying that he cold tested tooth number 10 and there was no response to cold on tooth number 10. Therefore, tooth number 10 will need a root canal. So my assistant came and told me that, and I read the report from the dentist. So I told my assistant, I said, tell me why tooth number 10 would not respond to cold. Let's say we did a cold test on tooth number 10 and there's no response to cold on tooth number 10. Why do you think that would be? I swear to whatever you guys believe in, she took one look at the PA of this tooth number 10, and said, of course this tooth will not respond to cold because look how calcified the canal is. My assistant knows more than some dentists. That's why cold test sometimes could give you a false negative or a false positive, in this case a false negative. Same patient. Would you expect this patient's tooth number 14 respond to cold? Look how calcified this tooth is. Would you expect it to respond to cold? And then if you did a cold test and there's no response to cold, you not realizing that the reason that this tooth is not responding to cold is because the canals are calcified. So you say this tooth did not respond to cold, therefore it needs a root canal. See, that's why you need to work on your diagnostic skills, because you can't rely on the cold test on such a tooth and just based on that cold test then determine that, come up with a diagnosis and a treatment plan. It'll be false. Dr. Lin, rest in peace, brother. 73-year-old patient, tooth number 7. According to the patient, the root canal was done over 40 years ago. No issues, no problems. Look how short that fill is.